Welcome to the Evolving Past Alzheimer's podcast, where we are focused on bringing you information to help prevent from developing and improve from suffering with brain diseases like Alzheimer's and other dementias. I'm Dr. Nate Bergman, a physician and Chief Scientific Wellness Officer at Kemper Cognitive Wellness, and I'll be your guide on these sound waves. So whether you're a baby boomer who's worried that your brain wiring just isn't working like it once was, or you have a loved one with the disease, or you yourself have already been diagnosed and are wondering, what do I do now? You'll want to listen to this podcast. Each episode, we introduce you to the top doers and thinkers that are revisioning Alzheimer's, dementia, and just generally things in life's second half. If you have questions or comments, check us out on social media. To support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show if you find these episodes valuable. That's Patreon, Patreon, patreon.com/evolvingpast. So here we go. Let's get better. Welcome back. I've been avoiding talking publicly about coronavirus, COVID-19, because things early on were so uncertain, and I just felt that commenting on it publicly seemed a little inauthentic or misleading. But now we have a fair amount of look back and quite a number of publications to read through. So I think it's time to start talking to our audience in our group, those that are struggling with or concerned about Alzheimer's, about what might be most relevant to us. Like some of the limitations of scientific medical evidence that people like me that are working in the trenches of medical practices have felt for some time are becoming evident to the public. It's interesting to see how this sort of the nature of uncertainty of scientific evidence and what constitutes scientific evidence and who's funding what and sort of the politicalization of some of this. Interesting to see how it's playing out on an international stage, not just in the United States. I can tell you that for many of my patients, both with Alzheimer's as well as other conditions like vascular dementia, Parkinson's, progressive aphasia, etc., they're having a considerable amount of trouble in these times since COVID started. In fact, we just saw somebody in the office this week who never had an issue, late 70s, and in the last 6 months since COVID started, she's developed a very, very profound amount of evident brain damage, and now she's has all the signs of early Alzheimer's. Just in the last 6 months, literally since COVID started. So the obvious reasons for worsening symptoms are things like not being able to socialize, get out, and work and do the things that keep people normal, right? This idea we'll talk more about in future episodes of embodied cognition. But what I want to spend some time, and this won't be a particularly long episode, but I do want to dig into the idea of NeuroCOVID. What exactly do I mean by NeuroCOVID? Well, we mean neurologic symptoms that are seen as a result of getting COVID-19 or SARS-CoV-2. Most of us know or are aware of people whose only symptoms of COVID might be loss of smell or taste, right? Those are considered early symptoms. I know this is the case for my sister-in-law and my sister. I would probably add headache, dizziness in there as well as neurologic symptoms. But as people progress, some of the later stages of NeuroCOVID might be confusion or altered consciousness, sort of in and out of a clear state. Memory loss is a big one. We'll talk about numbness and tingling, even loss of reflexes for some people, and then again in the later stages, strokes. So there's an open question, right? Is there sufficient basis for the introduction of the construct of NeuroCOVID, right? And I think that the sort of international consensus is yes. There are a number of worldwide initiatives that are going on right now, people that are being put into databases. And so we'll have a lot of study on COVID for decades to come. And it's difficult to do this kind of coverage because this has really got to be ongoing. Because when we think, okay, what are the numbers? One thing we know is that this will change, right? In terms of evidence for COVID, coronavirus, and particularly the NeuroCOVID that we're talking about. So evidence will change, but at the time of this recording, published scientific journal articles report a fairly significant percentage of people developing either minor or some major neurologic complications after having been diagnosed with COVID 19. And so, depending on the study you look at, up to 84, 88% of people have neurologic symptoms. One thing seems fairly clear to me from the literature. Again, you have to constantly, as you all know, you have to constantly be updating your awareness and knowledge of literature. It seems like the sicker people are with COVID, though, the more likely they are to develop neurologic symptoms. For example, if someone's in the ICU or have been hospitalized and are requiring oxygen, they are likely to have more significant neurologic sequelae or symptoms that last than someone who might have only just had to stay home for a couple of weeks, fevers, chills, muscle aches. That having been said, though, loss of smell and taste, which we call anosmia and dysgeusia, many people's only symptom that's reported, right? So just to give you a sense of the breadth and the range of this NeuroCOVID stuff, one study in hospitalized patients of COVID-19 in China, in Wuhan, found only 5% of people lost smell and taste. This would be in contrast to some of the European papers that came out that we're talking about 34% or 88% of people having these symptoms. So again, wide swath, but if it's a very significant number of people that end up with neurologic consequences, either mild or major. I think one thing that's interesting to note is that some of the studies show that people have had neurologic damage because of COVID-19 or confirmed COVID-19, either had mild or sometimes no respiratory symptoms. So none of the classic lung and shortness of breath, et cetera, that people can get with coronavirus. I think that's curious and sort of worthwhile to know. So how do we think that COVID is getting into the brain and nervous system? So there are a couple of theories that are coming online here. They're pretty interesting. So either it is COVID sort of hitches a ride in blood cells or in the lining of blood vessels, and they circulate into the brain through the blood-brain barrier, or perhaps COVID-19 as a virus climbs its way through the nasal cavity and works its way up into the nervous system, the nerves in the brain. There's kind of a third theory that may be a little bit of a tie together of some of the other ones, but that damage happens via this blood-brain barrier. Might be causing sort of an immune response, right? That's sort of our body's security system going haywire. And that ends up being a cause of some of the actual neurologic damage. But at this point, these are primarily just theories. I mean, they have mechanisms that make a lot of sense, but they're still sort of in the realm of theory. So we'll continue to follow the science on this for you. But as we begin to track the literature towards Alzheimer's and dementia vis-a-vis COVID-19, another recent study showed that at the time of leaving the hospital, so these are people, again, hospitalized folks with COVID-19, a third of them, 33% of them, had something called dysexecutive syndrome, right? Which is actually more and more we see in the Alzheimer's literature. There's this sort of idea that executive function is impacted. And executive function is really, these are dysexecutive syndromes, sort of inattention, poor orientation, meaning I'm not sure where I am exactly, what time it is, and then difficulty sort of carrying out tasks that people are asked to do. Either they're asking themselves to do or having trouble getting organized in space, so like motor tasks, or even just sort of cognitive tasks, like I'm trying to mail an envelope or something like that, figuring out the steps that someone needs to do. That's dysexecutive syndrome. So a lot of people that have coronavirus or COVID-19 have these sort of issues. And we see that also with Alzheimer's, right? And although there might be another sort of layer, I just read an article this morning, there might be another sort of layer of people that are getting diagnosed with Alzheimer's that may just have a non-neurodegenerative, it's something that is not going to progress into full-blown Alzheimer's dementia, but they just have problems with like executive function. But what we know with NeuroCOVID is that some of the imaging studies, so these are like MRIs that are done, pictures of people's brains, show that the area in the brain bilaterally, so on both sides, there's an area called the frontotemporal area, right? Sort of just behind the cheekbones, if you will, that really show hypoperfusion, so less blood flow, problems with connectivity and connection there. And we also see, and that's sort of verified through EEGs, right? Through an EEG, so electroencephalography. So these are a measure of electrical activity. And so we have a sense of what's normal. So they'll have abnormal EEGs or disorganized EEGs. These are people that have been diagnosed with COVID that have neurologic symptoms that are getting MRIs and EEGs of their brains. Right? I think it's the MRI findings to me that are particularly interesting with COVID and Alzheimer's, although the EEG is interesting as well. The reason the MRIs are interesting is because we know from a couple of other well-characterized viruses like herpes simplex virus 1 and HIV, both of which are known to cause brain damage and cognitive impairment and their own sort of dementias. Of course, HSV or herpes simplex virus is very linked to Alzheimer's, but they also tend to affect the same areas in the brain, right, close to where COVID is, right? They tend to affect something called the mesial temporal lobes, very close to where we're seeing these MRI abnormalities with the COVID studies. Of course, in the mesial or the medial temporal areas, as they're known, is where the hippocampi area of the brain is located, right? And I'm going to come back to the hippocampi or the hippocampus, plural hippocampi, in a few minutes. So let's just sort of tuck that in the back of our minds, and I'll remind you why that's so important, right? So to take one step further with the connection with Alzheimer's and COVID, a recent Korean study was published at the end of June showed that there were 3 big risk factors for COVID. People at higher risk for getting infected by COVID, those are people that are over the age of 70, people with underlying lung problems, and then people with Alzheimer's disease, right? So that begs the question of what is it about Alzheimer's that predisposes someone to COVID-19 or SARS-CoV-2? So it seems like it's around this gene. If you haven't heard of it yet, it's the ACE2 gene, angioconverting enzyme 2 gene, right? So that's a code to make like a door, like a receptor on your cells, right? And so this acts like a door for the virus. So if you have more ACE2, there's more doors, right? This gene is upregulated, so it makes more of it in people with Alzheimer's. So I guess to sort of make this simpler, in other words, folks that are 70 and up, and certainly if they have Alzheimer's, seem to have more of this gene expressing itself. So it's more present. So it's like there's more doors for the virus to enter through, kind of like giving the enemy more locations to enter the fortress, if you will. Now let's circle back to the hippocampus that I mentioned before. It's interesting to note that Korean study that we just talked about, the Korean group, they were looking at gene activity in areas of the brain called the hippocampus, right? So for those of you that are familiar with this podcast or have listened to other episodes or just familiar with the Alzheimer's world in general, it's widely accepted that one of the most classic biomarkers for Alzheimer's shows up as a shrinkage in the area of these brain called the hippocampus. Where exactly is the hippocampus? Just a refresher, I'll get my gross doctor speak on for a second. You know, my mom was a pathologist, and one of the more interesting days growing up was when she brought a cow skull home from the butcher, and we did an exploration on the kitchen table with my good friend Jared at the time. So I was trained well from a young age. So just to get a sense of where the hippocampus is. So if you would take your finger and stick it through your nose and then sort of push through the skin and bones that's there, there's a little bony area called the cribriform plate. And basically right behind that is part of the hippocampus. And then you have it on both sides of the brain. So there's hippocampi on both sides. So that area of the cribriform plate, that bony area there, is also right near the seat of the blood-brain barrier, right? So the blood-brain barrier is a very thin layer that was essentially once thought to be kind of impenetrable or at least selectively penetrable, sort of like a really good security guard or a good chain of security guards. But in cases where things are getting past this barrier, it seems like the barrier might have been injured, right? Or it's leaky, it's vulnerable. So we're learning more and more about this sort of blood-brain barrier problem. And actually, it's an emerging theory in Alzheimer's, is problems with blood-brain barriers. So the thinking is that the virus probably enters the nose, and boom, the hippocampus is right there. So with increased points of entry for coronavirus, that's kind of what's happening. So it's, of course, it's not a complete explanation, because many of the Alzheimer's folks that have Alzheimer's have this area in their brain shrunken. It's sort of shrunken, which would mean there's less tissue, which raises the question of, is there something about vulnerability of that area in the brain to the virus for those that have Alzheimer's? That's what the Korean paper seems to be suggesting, that for people with Alzheimer's, there are just more points of entry because of an increase in this expression of the ACE2 gene. Now, frustratingly, there isn't anything I'm aware of yet to do about this. Of course, we're all hearing about promising vaccines and sort of other medications possibly, but wearing a mask, especially an N95 mask if you're looking to protect yourself, if you have access to one. Though for some reason this is still controversial, even though my reading of the majority of the scientific data suggests that masks are at least one way to limit the spread of an infection. Not that it's certainly not perfect, and there's all kinds of shortcomings. So if you aren't diligent about wearing a mask, it's probably time to be wearing one, at least where we're at as a collective in this country. Though it seems that the recent news was not a neck gaiter, as I'm sure you've all heard, especially if you're indoors. Now, outdoors is a different story, but at least being at a good distance, somewhere between 6 and 12 feet, just, kind of general application of common sense. So I think from a prevention standpoint, for those that are at risk for Alzheimer's, right, especially those that have high-risk copies like ApoE4, where there's even more inflammation, which we'll talk about here in a second, that's possible, that group should be particularly diligent and probably consider investing in an N95 mask, not only to protect others, as we do in general when wearing masks, but the N95 really confers more protection to ourselves as well. That's probably worth doing. Second interesting point I want to bring out on coronavirus and COVID is around immune system and inflammation. This is really a growing area in the literature, and I actually hope to have somebody on as a guest here in the near future to talk about some of the implications here. But in NeuroCOVID, there seems to be this sort of systemic as well as localized neuroinflammation. So the entire body, and then specifically the nervous system, becomes inflamed. So there's like this surge of inflammatory chemicals in the body with COVID. Some people get, and this then appears to trigger an immune system problem, right? The immune system goes haywire, and that's probably what's triggering the blood-brain barrier breakdown. And so kind of as a result of all this immune system hyperactivation, you get multiple immune complications. So we're seeing blood clotting and strokes and loss of reflexes and fatigue and problems sleeping and anxiety and heart damage. And there's just sort of like this cascade of physiologic events that happens after the immune system gets ramped up. So I want to introduce or reintroduce this notion of inflammaging. So it's a combination of inflammation and abnormal immune cell activation that goes along with aging. Right? In the United States and in many countries now around the world, we are accelerating this process in general, regardless of COVID, because we have blood sugar imbalances and obesity and hypertension and sort of et cetera. So it's interesting that blood sugar imbalances, but particularly obesity, have been consistently shown to predispose people to having a tougher time either getting COVID or having a tougher time with COVID and getting damaged by COVID. So there seems to be some kind of metabolic switch or set of switches that turns on or dials up, flips on parts of the immune system that accelerate aging and illness. And so I think that's what we're seeing in part with NeuroCOVID. So when we talk about dialing back on inflammation, we really always have to go back to the basics, right? Healthy diet, getting enough sleep, exercising, finding ways to manage the stress that come with this whole thing, and just, the rest of life in general. So those are all the things that are also known to drive the body away from inflammation and accelerating aging, and they theoretically protect us, right? Mechanistically speaking, they confer protection from more severe COVID cases, et cetera. That's my conjecture. That's my opinion, to be fair, but it is cited in a few peer-reviewed journal articles, and so I think we're on good ground. And there's no real side effect to eating right, sleeping right, and exercising, right? The side effects are all good. Now, what about energy, right? What about our mitochondria, energy power plants inside our cells? Of course, again, this audience is probably aware that one of the emerging leading theories as to why people are developing Alzheimer's is a problem with their mitochondria. Right? As one of our previous guests, Dr. Majid Fotouhi, I think was our third guest on the show a few years ago, he's really a world authority on all things of the brain. He recently published an excellent paper outlining the stages of so-called NeuroCOVID. And one thing he points out there is, he says, because neurons have significant levels of this ACE2 receptors, which allow the SARS-CoV-2, the COVID-19 virus, to penetrate these neurons. They disrupt mitochondria and protein folding. It disrupts normal cell architecture and function. So theoretically, this may make patients vulnerable to dementing neurodegenerative diseases decades after acute illness, right? So dealing with mitochondria might be another possible target. And again, from a prevention standpoint, this is not something we want to kind of play around with and say, well, everybody just get it, because we are not sure yet the long-term consequences, at least for people that are higher risk, right? Now, what about COVID's impact on mental health? Yeah, I think we're all sort of familiar with this and kind of heard this a lot, and probably many, if not most of us are sort of experiencing this impact on our sort of mental and social health. It's the hardest thing to measure, though. As a doctor and a human being, I mean, we're all kind of going through this. I'm going through it for sure, because we're going through something unprecedented. Even though the vast majority of us will make it through this, mental health is taking a hit. Like frontline health professionals are getting diagnosed with anxiety, depression, suicidality, PTSD. I think I mentioned once a psychiatrist, friend of mine, colleague of mine, said that we're sort of global PTSD. Long-term mental health repercussions are, even in the general population, much, much higher. The number of calls to national disaster distress helplines are increasing 300, 600%. These are indicators of mental health. So I'm very glad, as I'm sure many of you are, you're not a public policymaker right now. But I'd say, when you take the totality of this, there's been a little bit of unfair treatment of the nursing home and assisted living industries. These people are taking care of some of the most vulnerable populations around. And many of these people can't see their loved ones. They can't see anyone that they really know, even if they would recognize them. And so, that's the most accelerated and most exaggerated and extreme case when it comes to COVID and isolation. It's clear to me that part of why we're seeing a decline in Alzheimer's and Parkinson's particularly is because of sort of lack of routine, lack of normal socialization, a loss of a break in routine, which are all, as we know, very, very important as people. Routine, kind of where we put our bodies and minds and nervous systems on a day-to-day basis. When routine is broken for people that already have pretty broken minds and brains, it becomes very difficult to stay the course, if you will. And so we see a regression or a collapse in many people's symptoms with some of these dementias. Another thing that I think is worthwhile pointing out in Dr. Fatui's paper is talking about what kind of evaluations could be done. So he's talking about standardized, and this is a quote from his paper, standardized evaluations such as quantitative EEGs. We call them brain maps at Kemper Cognitive Wellness, where I work. Fluid biomarkers, so that can be cerebrospinal fluids, spinal taps, but then certainly just blood-based markers, things, blood work. Cognitive evaluations, and then various types of multimodal neuroimaging, things like MRIs. So those might lend insight into possible long-term neurological consequences in COVID-19. What kind of consequences are we talking about? Depression, memory loss, mild cognitive impairment, Alzheimer's, even Parkinson's, right? So there really is something we can do now, though it's experimental. It's likely worthy of learning more. We do those kinds of evaluations on a regular basis where I work. So what can we do to protect ourselves, right? So we talked already about the N95 mask. Otherwise it's a surgical or cotton mask, especially when you're inside. Distance is still a big thing, 6 to 12 feet, 2 meters. Trying to get outside, I think, as much as air movement as possible, or recycling air in your indoor environment. There's definitely people using filters, indoor filters, keeping windows open if you're in a climate that allows for that. So it's an interesting time, right? It's an interesting time. But if you have other thoughts about this sort of mask issue, I'm trying to understand all the angles here. I'd love to hear from you. Please respectfully reach out on Facebook, Instagram, Twitter. You can email me at nate@evolvingpast.com. I'd like to understand more of this issue. There's a question a number of people have asked. It will start to be flu vaccine time. People want to know whether they should get the flu vaccine. And you have, this is also another charged issue. The science is not 100% clear. There was a military study in January of this year that really circulated around that appears to link an increase in a couple of virus families, including the coronavirus family, to the flu shots. In other words, people that got a flu shot maybe picked up more of other kinds of viruses, including coronavirus. But what about the specific link to Alzheimer's and flu vaccine? There's another study or a couple of studies. The one that I'm aware of is out of the University of Florida, I believe. And I think they're McKnight Brain Institute. We had a guest on with Adam Woods from McKnight, who's a neuroscientist par excellence. That study showed a flu vaccine linked to reduce Alzheimer's, right? So reduced Alzheimer's. So again, I'd say the data is really not clear. So when people are asking me, whether or not they should you should get the flu vaccine, I think you got to go back to just the basic standards of care, because I think the evidence is not screamingly clear here yet. So we have mixed data, and I think it certainly probably depends on what's going on under the hood with people, but most people don't know what's going on at the sort of a basic biological level, a genetic level. So we just go back to this general guidelines, standard guidelines. I think, though, another thing regarding the vaccines, what might be going on here, again, is this going back to this concept of inflammaging. What we see is this chronic low-grade inflammation, which is this is a general failure of the body to heal. So there's like a decade of literature with vaccines and Alzheimer's, and we know that higher presence of viruses are found in brains of people that have Alzheimer's. So things like HSV, like herpes simplex virus 1 and 2, HHV6, or another form of herpes family virus, CMV, cytomegalovirus. But exactly how one leads to Alzheimer's dementia is not clear. So it looks like it has something to do with the nexus, or the point of connection between inflammation and immune system, and what that does for our inability to fend off viruses. And so I've been following that story for a couple of years. So, how do we protect ourselves? And so we'll kind of close on this. Well, unmanaged stress, just learning basic breathing techniques, breathing in like a box breathing in for the count of 4, holding that inhale for a count of 4, exhaling for the count of 4, and holding that exhale still for a count of 4, and just doing that 4 or 5 times, that can have a profound effect. That's a data-driven way to reduce stress, deal with stress, increase resilience. There are numerous ways to improve sleep. We can talk about that on other episodes and shows. Avoiding isolation as much as possible. Obvious things like Zoom and FaceTime, staying connected on the phone, making sure you stay connected to people you care about and people who care about you. This has been particularly helpful for me during this time. Eating a low inflammation diet, exercise and movement, these are all been profoundly helpful to me. Supplements, yeah. So supplements, again, I don't want to sort of over promise on the supplement side, but there is some data on the supplements. Most of us want a randomized controlled trial for coronavirus or COVID-19, and as we know, like those are hard to come by, and really well-designed ones even really harder to come by, and an unbiased one is really impossible to come by, almost really impossible, because there's always some bias, right? There's always have some agenda. Now, we might agree with the agenda might be very noble, but we're measuring things with an agenda, by and large. So just some of the supplements that can be helpful. There's a long, long list. I'm just going to mention a few here. Zinc. So that could be zinc citrate, zinc picolinate, zinc acetate. What's the difference in all these zincs? So zinc, like a lot of minerals, magnesium, etc., have to be bound to something called a chelator. So you're always going to see 2 names. You're going to see zinc, and then you'll see a second name like citrate, picolinate, acetate. That's the chelator. That's what helps deliver the zinc so it gets to you. So something, again, you need to ask your healthcare provider before. This is not medical advice, right? Obviously. So particularly people on blood thinners, medications, antidepressants, etc., they really need to take caution to clarify these for yourself. But zinc can be helpful, about 30 to 60 milligrams a day. This probably still has the strongest evidence. It seems to support various aspects of the immune system. An interesting story about zinc: my sister, who lives outside this country, outside the United States, recently lost her sense of taste and to some degree smell, but really the taste, for months. And we recently put her on a regimen, and now her taste is evolving. It appears like her taste is coming back online. So she's starting to taste a few tastes more intensely, the sweet tastes and so this bitter taste. It's really interesting to see this. It's not a few of the things that I'm mentioning now. Quercetin, somewhere around 1 gram, again, by mouth twice a day. This has antiviral properties, many kinds of viruses it's been studied with. N-acetylcysteine, although there's a little bit of controversy around this now, just recently, N-acetylcysteine has been used for a long time, 600 to 900 milligrams twice a day. Again, all these are oral things with pills you could take. There was a study, I think, of like 260 some odd people that were of older age, people getting 600 milligrams of N-acetylcysteine. So N-acetylcysteine is spelled N-acetyl, and then the second word is cysteine, cysteine. And it's also can be abbreviated as NAC, NAC. So this group of people that were getting 600 milligrams of NAC twice a day versus a placebo had less flu, right? Less flu and days in bed. So that's an interesting one. And NAC actually has quite a bit of studies under its belt. Resveratrol, 100 to 150 milligrams a day. That seems to regulate large inflammatory gene complexes. Curcumin, something like 500, 1,000 milligrams twice a day, also seems to regulate these large genes that have to do with inflammation. Vitamin D3 should be an obvious one. That's an immune system modulator, and it also seems to reduce inflammation. Somewhere 5,000. You could take more for short periods of time, up to 10,000, but I wouldn't recommend that long term without checking levels and working with a healthcare provider, which I would just recommend in general, of course. Like again, I said, this is not medical advice, clearly. Vitamin C can be helpful. Vitamin C ascorbic acid, 1,000 to 3,000 milligrams a day. You can split up. You can take like 1,000 3 times a day. Some people get stomach cramping, diarrhea. You just have to, basically adjust the dose down. So take less if you're getting stomach cramping. But this also seems to enhance various aspects of the immune system. Like I mentioned, there are a lot of other supplements, but these are kind of the basics. If you'd like more information on where and how to obtain high quality supplements, please email info@kemperwellness.com. That's my company. That's info at Kemper is KEMPER wellness, WELLNESS.com. And we can direct you to those resources. And if you have questions or comments that you'd like us to address, please find us on social media or email nate@evolvingpast.com. And then lastly, thank you for listening. We so appreciate support. It's good to reconnect here. Please stay safe and healthy. And maybe after listening to this, try to go call or FaceTime someone you love. So that's our episode. I hope it was useful to you. Check out the show notes on iTunes or on our website where we've summarized the key points. If you find the information here valuable, please consider giving us a 5-star rating on iTunes and leaving comments in the comments section. It will really help us bring this message to as many people as we can. If you have questions or comments, connect with us on social media. Finally, to support us, go to patreon.com/evolvingpast and consider hitting the button and becoming a patron of this show. That's Patreon, Patreon, patreon.com/evolvingpast. Thanks, and talk to you next time.